Intermix the oral solution. Okay, so, but if you see the chemistry part of tamoxifen, all right, tamoxifen is a prodrug, okay? It requires conversion by phase 1 drug metabolizing enzyme, cytochrome P450, to its metabolite 4-hydroxytamoxifen and endoxifen, okay? Now, this 4-hydroxytamoxifen and endoxifen have got better affinities for binding affinities for estrogen receptor, alpha and beta, compared to the prodrug tamoxifen. Okay, tamoxifen is a prodrug. As you go, the first part of conversion, you will realize that I drug metabolizing enzyme, cytochrome P450, its metabolite, only because the cost of the metabolite was very high. Now, this 4-hydroxytamoxifen and endoxifen have got giving me a narrow window to develop the optimal formulation. Okay, so therefore it's only feasible for me to use the prodrug during the initial screening and basically use the metabolite once I have finalized the formulation and in the in vivo studies, okay, which we'll be seeing shortly. As of now, there have been a couple of clinical trials on tamoxifen metabolites as local transdermal therapy for breast cancer. Okay, so my work is not the first work. However, the clinical trials reported previously have used hydroethanolic gel-based formulation, right? So they've used 4-hydroxytamoxifen in a hydroethanolic gel. The problem with hydroethanolic gel is that it contains ethanol that are known to dehydrate the stratum corneum and increase the fluidity of the layers, subsequently enhancing the penetrating effect. Okay, so basically I wanted to take a different approach, one that would not compromise the stratum corneum. Hence, the research significance would be to find an alternative drug delivery system that is safe and be able to deliver drug directly to the site of the tumor while avoiding the first part's metabolism and consequently the side effects. Okay, right. So coming back to the transposome that I mentioned a few slides before, now transposomes are highly deformable lipid vesicles. Okay, they are able to penetrate the intact skin if applied non-occlusively. Right, they have been shown to have better membrane integrity compared to liposomes. And they are mainly composed of lipids and edge activators, which is often like a single chain surfactant. So we're talking about things like sodium cholate, span, tween, right? And the mechanism of penetration used by transposome are through the intracellular or transcellular pathway using an osmotic gradient, right? This particular feature is thought to enable transposomes to squeeze themselves through the intercellular regions of the stratum corneum, okay, under the influence of the transdermal water gradient. Okay, they have been reported to penetrate the intact skin in vivo with an efficiency similar to subcutaneous administration. Okay, but the key thing here is provided that the elastic vesicles are topically applied in a non-occlusive condition. Non-occlusive means it shouldn't be covered on top of the skin, right? So just a brief explanation about the transdermal hydration gradient. Okay, it's basically also known as the osmotic gradient. The gradient is created by the difference in total water content between the skin surface and the skin interior. Okay, here I would like to stress that the water concentration at the epidermal surface is about less than 15%. Okay, but as you go deeper into the skin, it reaches it increases 5-fold more compared to the surface value. You're talking about at the basal level skin layer, the water concentration is 5-fold more. So when the transposomal formulation is placed on the surface of the skin and are partly dehydrated by water evaporation loss, the lipid vesicle basically feel this gradient and try to escape the complete drying by moving along. So it's going to go moving towards the direction of water. All right, so it's going to move along the gradient. And this can only be achieved if the vesicles are sufficiently deformable to pass through the narrow pores of the skin. Okay, I would like to also point out here that this system, again, stressing, works only under non-occlusive conditions, as basically occlusion prevents this vesicle penetration into and through the intact skin, as if it deprives the vesicle from the main driving force. Okay, so basically this is what happens. All right, so the deformation leads to dehydration, and then rehydration leads to reformation of the formulation. The phospholipid hydrophilicity plays a part in which it tends to avoid any dry surrounding, okay, which causes the vesicles to resist the dehydration at the skin surface. Okay, and hence for it to remain swollen, it has to follow the local transdermal gradient moving deeper into the skin strata. Okay, and the edge activator or the surfactant here plays a role in providing flexibility to the vesicles. Now, moving on, bringing all this together, we developed the formulation and we did physical chemical characterization, optimizing studies, right? So the transversomes were prepared using a thin film hydration technique. And like I mentioned, it was formulated using the soy phosphatidylene choline, the edge activator, the retite oil. So here we tried either with ostrich or emo oil, and using tamoxifen, and the final formulations we use for hydroxytamoxifen. Okay, they were subjected in rotary evaporation for 40 degrees for an hour, and then reduction in size using an ultrasonicator. Okay. And then the deposited film was hydrated with PBS, rehydrated with PBS before reducing in size. And we use DCM as the solvent phase for the formulation process. Okay, so for optimizing purposes, we tried 5 different ratios of SPC and EA. And we use 3 different edge activators. Okay, so sodium cholate, sodium taurocholate, and sodium deoxycholate. And we ensured the final lipid concentration to be 5% and the final drug concentration to be about 0.1%. Right. So after developing the formulation, we screened all the formulation to find the most optimum formulation. So we performed the physical chemical characterization by studying the drug entrapment efficiency, vesicle size analysis, transmission electron microscopy, residual solvent analysis, differential scanning calorimetry, and also physical stability. So from the drug entrapment efficiency studies, overall, all the formulations, before that, I have to stress that the drug content was assayed using a validated reverse phase HPLC method, right? So overall, all the formulation had more than 50% entrapment efficiency, with the highest drug entrapment efficiency observed in 85-15 ratios of SPC and EA, in which sodium deoxycholate was the surfactant. All right. So the high entrapment efficiency here overall could be because of the increased bilayer in the lipophilicity and reduced permeability of the bilayers. Okay, so basically leading to an effective intercalation of the lipophilic drug within the hydrophobic core of the bilayer. Okay, that causes the enhanced drug entrapment efficiency. The preparation method could also have contributed to the increase in entrapment efficiency. Formation of a thin film with large surface area basically enables complete hydration of vesicles. Okay, right. And then we moved on to do particle size analysis. So all formulations showed vesicle size in the nano range. The smaller particle was preferred, of course, as it increases the surface area for the penetration. There was no significant difference observed among the vesicle size of deformable liposomes in the presence of different edge activators. Okay? However, within each surfactant group, the difference in vesicle size between the formulation was significant. with increase in vesicle size in formulation with retide oils. So the moment you add retide oils, we notice the vesicle size were larger, right? And in this case, based on the physical particle size analysis, we found that sodium taurocholate produced the smaller size vesicles for all the formulations. In terms of particle distribution, size distribution, the PDI values for all the formulations were below 1, basically emphasizing that the vesicles were all monodisperse, right? We also did the morphology studies using transmission electron microscopy. And as you can see here, the surface morphology shows outline and core of the well-identified spherical vesicles. There was a well-defined unilamellar structure obtained for almost all the formulations, except for ostrich oil, the formulation with ostrich oil. It showed a more clumpy vesicle and basically caused reduced stability of the formulation. Okay, so as you can see here, the double layer here, the whole formulation was a bit more clumpier side. In terms of differential scanning calorimetry, we did perform a peak transition for tamoxifen alone, which the chromatogram is not shown here. And then the DSC studies was done on all the different formulations as well. And the decrease in TM value basically indicates that the retide oils basically disturbs the packing characteristics and thus fluidizes the lipid bilayer, right? The presence of tamoxifen did not alter either the TM values or the enthalpy values, indicating that the entrapment of the drug molecule in the hydrophilic core of the transposomes. Okay. We also did residual solvent analysis to check if there was any DCM still present in the formulation. However, gas chromatography studies for that showed no presence of DCM. Finally, we did the physical stability studies. Okay, so the stability studies was done under two environments. Was done under 24 degrees and refrigerated condition, room temperature and refrigerated condition. But however, we found that the refrigerated conditions were the best. Okay, and as you can see visually when we inspected, there was a separation in the oil layer for both the retide oil formulations for 4 weeks onwards. However, the plain formulation without the retide oil didn't show any appreciable changes visually. Okay, and as you can see, over time, the vesicle size increased and the entrapment efficiency as well decreased. All right, so the best here would be still the formulation without the retide oils. So when we pull together all our findings, we managed to conclude that sodium taurocholate was the best or the most suitable edge activator compared to the other two, sodium cholate and deoxycholate, giving a good entrapment efficiency between 65 to 93% and a good vesicle size as well. The developed transversome showed no residues of DCMs and was stable for up to 4 weeks in refrigerated conditions. All right, and we selected the 3 ratios for ex vivo permeability studies, right? So now that we managed to optimize the formulation that we wanted, we carried on doing the ex vivo permeability studies. So we use biological skin. Okay, basically we use the skin from the porcine ear. We mounted it on the Franz diffusion cell, and we studied the permeation across that. We studied for a few characteristics. So the cumulative amount permeated, the max flux, permeability coefficient, and also the enhancement ratio. Okay, so based on the cumulative amount permeated, we still find that the formulation without the uh, retide oils showed better penetration or higher penetration. However, the formulation with emu oil showed good release profile, okay, almost very similar to the one without any retide oil. Okay, so this could be justified by the presence of high oleic acid in emu oil. Okay, however, if you notice in ostrich oil, the formulation with ostrich oil, the last three lines here, had a poor release profile. All right, this could be because of the presence of palmitic acid. All right. Um, so basically, oleic acid, okay, why I say oleic acid is good is because it's a known permeation enhancer. The bent conformation is known to intercalate between the liposomal bilayer, causing decreased phase transition temperature of the skin lipids and increase in their fluidity. Okay. However, contrarily, high content of saturated fatty acid, which is the palmitic acid found in ostrich oil, are of linear shape. Okay, hence it has a reduced capability to disrupt the lipid packing of the stratum corneum. Okay, and it's difficult for it to intercalate with the lipid bilayers, resulting in a poor permeation. Right. So based on the permeability parameters, amount of tamoxifen permeated at 10 hours was significantly increased compared to the control. Okay, so control was just plain tamoxifen. Transfersome formulations in this study exhibited a marked increase in the Jmax in comparison to the control. Okay, so this can be explained through the mechanism in which the vesicle act as a penetration enhancer. The vesicle bilayers basically enter the stratum corneum and subsequently modify its intercellular lipids and consequently increase its fluidity. High affinity of phospholipids for biological membranes results in the mixing of the vesicle phospholipid bilayers with the intercellular lipid bilayers of the skin. Okay, so contributing to the permeability enhancement of the transversome formulation, as you see. Okay, so from this study, we found out that 85-15 ratio of phosphatidylene choline and the age activator, which is sodium taurocolate, was selected to be the most suitable formulation composition with a higher permeation rate compared to other ratios. So like I said previously, from the optimized formulation, now we included 4-OHD. Instead of tamoxifen, we included 4-OHD. And we did a brief run through of the physical chemical characterization once again, more importantly, the entrapment efficiency and the vesicle size, and also the permeability characteristic studies as well. All right. So you may ask, how can you just replace 4-OHD and tamoxifen? Okay. Just like you all to know that both of them are lipophilic drugs with log P values, with almost similar log P values. And being a lipophilic drug, the characteristic between the 4-OHD transfersome formulation and tamoxifen transfersome formulation did not differ significantly. Okay. And however, the increased influx for all the formulation, 4-OHD formulation compared to the tamoxifen, if you see the flux, you will notice that it's increased compared to the tamoxifen formulations previously. All right. This could be attributed to the presence of the extra hydroxyl group in 4-OHD compared to tamoxifen, right? So the overall maximum drug release from DLT and DLTEO, which is the formulation without emu oil and the one with emu oil, were found to be only about 7 to 8% of the initial amount. Okay, so not so much went in, but about 7 to 8% of the initial amount. Okay, so in summary, overall, the maximum drug release, like I said, was between 7 to 8%. And considering the use of biological membrane compared to the artificial of synthetic membranes, right? So, so this is basically the summary. So we moved on further from this work to remove ostrich oil from the formulation, and we focused more on using emu oil in our formulation. Okay. This work has been published in Journal of Liposome Research early this year. Okay, so these are the two formulations that were used moving forth for the in vivo studies. Okay. Right. Now, for the in vivo studies, okay, so we did two. Basically, the in vivo studies were broken down into two fractions. So phase one was the toxicity studies, or I would say the skin irritancy study. And the phase two was to study the efficacy of the